IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hi and welcome to another episode of All Things Policy. This is Mahek Nankani. I work as an assistant program manager with the Takshashila Institution. So on the 28th of February, we are going to witness Rare Disease Day. And to talk about this and national policy on rare disease in the country, I have with me Dr. Harshit Kukreja, who works as a research analyst with the Takshashila Institution in the Health and Life Sciences vertical. So, hi Harshit, welcome to another episode. How are you? And I also think this is going to be our third or fourth podcast together.
Yeah, so this will be, I think, our fourth podcast together. I think I should do some podcast with other people. I'm a little tired
Yeah.
of hearing your chirpy voice every time I do a
I think
podcast.
more than that, we are always talking about things that are not very happy. I think we're always talking about diseases and COVID and the new variant. And in your last episode that you did with Shreya, I think you talked about death. So I think you are more morbid than anybody who works at Takshashila currently.
So it's a wonder that we want to improve the life of people. We want to improve society, and we are a little apprehensive talking about diseases, about death. So that is a very important conversation we should have.
Should we like just pat on our back because we are bringing these topics that nobody wants to talk about into public discourse?
Yeah, so I think it's a good thing we talk about these things. A lot of if we don't talk about health and we don't talk about disease, we don't talk about death. I have no idea how we want to improve the standard of living and we want to progress as a society.
Yeah.
Without these conversations, you cannot go forward. Even though they appear a little morbid, but the only truth in life is death and disease. Yeah, it's death. So if you don't talk about the sacred truth, I don't know what you want to talk about.
So, do you think people don't talk about these things and there are no regular conversations about health and diseases which affect a large population is because of lack of awareness?
Yeah, I think it is a little to do with the lack of awareness and how closely the community, the health professionals and the health community as a whole tries to guard the scientific expertise and how it is not very easy for a layperson to understand maybe something about a disease. But except COVID, it has been a 2.5 years. It was March 2020 when the lockdown started, right?
Yeah.
So except COVID, I don't think people have a lot of idea how do other diseases spread, how do they work, and why do you take certain measures and things like that. So the health is a bit technical, and I think it is a little guarded by the scientific community, which makes it difficult to have such conversations
Yeah,
for
correct. And
non-domain people.
yeah, you're correct. And that's what, like, even the topic that we're going to talk about, that is rare diseases. I'm sure there will be a lot of our listeners who are not aware what rare diseases actually are. And I think before we move into the discussion further, I think it's necessary to talk about what rare diseases actually are. Even though I was reading this document with some study which said that even though rare diseases, as the name implies, are rare in nature, which means that it impacts a smaller fraction of population. There are more than 7,000 rare diseases in the world, and those 7,000 diseases impact more than 300 million people across the globe. So what comes to my mind is, are these rare diseases actually rare? And when we know that there is very little motivation amongst the scientific community, amongst the government to do something about it, there are no financial resources garnered to seek for the device treatments and therapies. And I think that's what makes rare diseases even more rare because people don't talk about them. They don't want to talk about them. And as you correctly mentioned, they're very guarded by the scientific community.
So you were talking about that 300 million
Yeah.
number, right? So
Yeah.
that is not one disease. That is a lot of diseases which only a small population are affected. Only, for instance, maybe 5 lakhs, 6 lakhs people are infected all over, are affected by that disease. So 300 million is that bunch of diseases, that set of diseases, 6,000, 7,000, 8,000, whatever number we agree, whatever number you read. So those are mostly 7,800 different diseases. 300 million is the number that is clubbed together. So those are rare, but the group of rare diseases, they make a significant portion of the population. And
Yeah,
yeah, obviously rare diseases, that as the name implies. So I don't expect people to know a lot about rare diseases, Mac. They're rare.
very funny, Harshit. So, like, okay, I just want to talk about. I know we've been wanting to do this podcast for a long period of time. We've been talking about rare diseases, and then we somehow mutually agreed that we'll do podcast somewhere nearer to the rare disease day. But how did you end up being interested in this?
So I think I've told you the story. After my final year, before my internship, I did a short stint at Nimmans, Bangalore. So I was in the clinical genetics department. I was looking at patients with neurological symptoms which are affected by genetic diseases. Genetic diseases are basically rare diseases. So the thing is, in rare diseases, in these genetic diseases, I think you'll find less than 4% of the diseases which have a cure. The other 95%, we are only able to identify, okay, this is Angelman syndrome. This is XYZ disease. This is this. And we don't have data even on disease progression. We are not able to offer a lot of treatment options. Treatment options, experimental treatment options are available, but those are super expensive and not easily accessible to Indians because a lot of companies are not launched them, they're not approved. And have you ever heard that drug, it's pronounced something like Zolgensma? So you would have seen in your Instagram feed or somewhere on Facebook. It is a 16 crore drug, has to be given to children under 2 years, works mostly with children under 2 years, and is used for a disease called spinal muscular atrophy. And the government did not fund a lot of this. So South Asia has
Before we move on, you said the government did not fund. So this comes back to the point that we started with. Is it because it's rare and it does not affect a large population? So there is no financial support the government wants to put in. It would probably be funding diseases which are common to a lot of other people than having spent 16 crores or probably more than that in devising treatments and therapies which probably affect a very few number of people in a region.
Yeah, that is 16 crores plus, it was previously 16 crores plus customs and GST 6 crores. So that
Okay.
came out to be 22 crores. So the government is apprehensive to spend 16 crores on one person and is still apprehensive. The new policies also provides cover of 20 lakhs per person. So yeah, it is a thing that in 16 crores, how many people, how many TB patients you can treat in 16 crores, how many PHCs you can fund in 16 crores, how many safe deliveries, how many doctors you can hire, how many ASHA workers you can pay well. So it is a opportunity cost, and it is how you decide or how you allocate resources. And we are a developing country, so we are not that resource rich. And even resource rich countries like NHS and UK, which has the National Health Service, they also have put a monetary value, and they do not like give out money to, they have a limit. I think it's 10,000 to 20,000 pounds per year. If a medicine, it increases the life of a person by 1 year, it should not cost more than 10 to 20,000. There are certain exceptions. They have made some changes, but you have to put a monetary value and you have to see how your allocations are better managed.
Correct. And so last year, it was like almost during the peak of second wave when we had this national policy on rare diseases in 2021. And So do you think now finally we are going moving towards the direction when we are talking about rare diseases in India? Now is the right time that people are also probably interested. The government is also showing interest, and now it has full-fledged launched rare disease policy in the country.
So I would have wanted to see a better disease policy. I would have wanted to see more resource allocation to this policy. So what they did was they divided patients into three categories. The first group is for which you give one-time curative treatment, and that treatment is proven and that cures the disease. For this, the government is willing to pay, and that to support of 20 lakhs. 20 lakhs is a very minuscule amount. Lot of experimental, even the proven ones, they cost a lot because it takes a lot of money to develop therapies for which the volume is quite low. There's a second group which require long-term or lifelong treatment for instance diseases which require special diet or which require blood transfusions or which require recurrent medicines or something. Every year or every 6 months they require injectables. For that, they have left it to the state government. And the third group for which definitive treatment is available, but it is like quite high, the cost is quite high, or maybe the treatment is experimental, it is not proven. So for that group, the government has not provided anything. They have said ki will help patients get crowdfunding. So this crowdfunding part was ridiculed by a lot of people that it was already happening and you have left people to die. But that is the question of resource allocation. I would have wanted the doctor in me seeing patients such as this would have wanted the government to fund for everything. But I know that is not possible. But it would have been better if they have put more money. The one thing I would have preferred was if they were put more money in prevention. For instance, they would have put more money in educating ground level workers so that they can identify high risk couples who have a previous child with the same disease, who are in a consanguineous marriage, who marry within a small group, couple in which they have advanced age, the maternal age is more than 35, 40. So if they would have put more money into that, and that would have been a better use of resources.
Yeah, you are right, Harshit. Like, if we look at what are the circumstances with rare diseases, especially in India, so I think if we look in an idealistic situation, it should be the government who should be taking care of people who are suffering for rare diseases. And crowdfunding and things like that do not make sense, especially in India. And while we talk about these things that the government has divided into categories, and then it has asked people.
Meg, so why do you say crowdfunding does not make sense in India? I think crowdfunding makes sense in India. I'll tell you why. So we say that we don't have a lot of resources and we are not able to devote a lot of resources to rare diseases. So in that case, student private funding be a way. So I don't
But
think
but yeah, if private funding has to be initiated, don't you think that the government setting up and initiating a large sum of fund can be the first initial step, and then these private corporations or people who are interested can follow up? But initial 20 lakhs does not make sense, honestly. With the disease as rare as these, I don't think so. 20 lakhs is an enough amount. How we're talking about a drug which probably costs 16 crores plus taxes, and you said some amount regarding 22 crores. So how about government setting up a fund, probably in hundreds of crores, and then these private corporations following up?
so. That drug, that is one extreme example. Obviously, the drugs are expensive and it usually costs more than 20 lakhs, but less than 16 crores. It's like more like 80, 91 crores. It is very different for different diseases depending upon subtype and everything else, life expectancy. But the private sector, the private philanthropy sector moves like way faster than the government. And I don't think, no, I don't think you can say that the government should take care of all the expenses. I would want that. I would definitely want that. I would want nobody to pay for like something as basic as healthcare, education, or food in India. But that is not a possible case scenario we're looking at,
Yeah,
right?
that's an idealistic situation. But what I meant to say is that government initiating it and then people following it up. I completely clearly
Yes.
agree with the point that government cannot take care of everyone. And that's a very idealistic probably
So I think it
situation.
happens in reverse. The private sector initiates, people go for crowdfunding and everything else, and then the government fall off. Because when they started this, when they made the first rare disease policy, treatment of national policy for treatment of rare diseases in 2017, after some discussion, they put that on hold. So at that time, the people who were supposed to be beneficiaries of the policy, they did not get the benefit. I think it was some direct beneficiaries, I think 140, 150. There were certain reports which said that around 150 people could not receive treatment because of this pause. So the government is usually slow. It has a lot of red tape to navigate. So I think it is usually the private sector which steps up, and then the government wakes up from its slumber and they're like, I think we should fund this.
I think we're just trying to shrug off the responsibility that a government has. But okay, we can let aside this and we can agree to disagree on some things. Moving ahead, we'll talk about definitions. So I was reading that how there is no one particular definition of rare diseases in the world, and WHO defines rare diseases differently, and countries define rare diseases differently. That's also because not every rare disease is probably common in their region, and that's how you'll find that probably WHO says, okay, if a disease is present in like approximately 5,000 people in a region, then that's what we call as a rare disease. USA probably has some other parameters or other numbers, and Japan has something else. But if you look at Indian policy document that came up last year, you'll see that they've talked about all of these things. They've taken examples from the world, but they have not talked about the definition. And there is no one definition in India, and it's been a year since then, and we still don't have it.
So, Meg, there is no definition because we don't have enough data. And they have, I think what I liked about the definition part was they have said that they'll define rare disease depending on treatment options and how prevalent is it in some part. It could be prevalent like somewhere, maybe in Karnataka, and it could be very rare somewhere in Manipur. So yeah, it's true they've not defined, and yeah, and I like the part when you were kind of wrong. You said, let's agree to disagree. That was a typical make move.
Yeah, that's how people at Takshashila should like we have different opinions, and like at one point we say, okay, let's agree to disagree. That we can have two different standpoints, and that's okay. I am okay with whatever beliefs you have, but I might not clearly
But
agree
you
with
were
you.
kind of wrong, yeah. Kind
That's
of
what
wrong,
you
yeah.
think. I
Yeah.
don't think so. We should like take this conversation and make our listeners think that we disagree. I think we can still talk about definitions. Go ahead. What were you saying?
Yeah. So yeah, the definitions part is like they're obviously not defined. So the interesting thing is Orphan Drug Act in the United States. So what it says that I think it's 2,500 or there's some number. So any number, any drug which is made for people, I think it's less than 20,000, 2 million, some two number, some XYZ number. So if there's some drug which is made for X number of people, the government will provide specific incentives and specific the clinical trial requirements are relaxed. So it led to a spur in innovation and everything else. It made the job of the regulatory authority super easy. They had a definition they could rely on, and it was a quantitative definition they could rely on, but it also had some unintended effects. So a lot of it's called salami slicing. What pharma companies did was they took some drugs which were meant for other diseases and did fancy reporting. And while they were developing them, said they were for some rare diseases or some rare aspect of a particular disease and got the benefits. So yeah, we do need a quantitative definition, but we'll have to like be careful how we frame it. And yeah, there's no good data in India in general, and there's no good health data, and rare disease data is like way sparse. So unless we get good data, we I don't think we can get a good enough definition. Yeah, but we do need a definition. We do need a definition. We can look at unintended consequences and everything else. But we do need a definition if you want to look at funding. They do have a appendix in which they list out some diseases but it's not a comprehensive list and it is a really small list. So yeah, we do need a definition.
Yeah. So I think we'll take a short break now, and post which we'll talk about what are the challenges that rare diseases spare faces in the world and in India in particular, and what are the consequences which occur when there is no one definition. I think we're going to talk about it after a short break. Listeners, I'll see you on the other side. Yeah.
Hello. It's been another great week on the IVM Podcast Network. On Raw and Organic, Kunal talks to Shivjit Gatke and Zahir Khan about how they came up with Step Set Go, a bootstrap startup. On Khel Niti, friend of the network Saurabh Pant joins Rajiv Mishra, Ayaz Memon and Sabah Karim to preview the India vs Sri Lanka series. On Pesa Vesa, Anupam speaks to Ram Iyer. He is the founder and CEO of the Vian Network. They discuss how trade finance works for local shops and SMEs. What is an oblate spheroid? The simplified hosts deconstruct the American football game and all there is to it. And on the Filter Coffee podcast, Karthik is in conversation with the Delhi High Court advocate Rohan Alva. They talk about his book, Liberty After Freedom, a history of Article 21, due process, and the Constitution of India. Do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. It really helps us. Don't forget to rate us on any of the platforms that you're listening to. And also remember, you can check us out on YouTube at www.ivmpodcast.com/YouTube. And finally, we'd like to thank our sponsors this week, Bank of Baroda and HDFC Life Insurance. Thank you so much for making this possible.
Hi, welcome back after the break. So before the break, we were talking about how we don't have data in India, and there are no health. There is let alone rare diseases. We don't have a lot of health data about people in the country, and this becomes one of the primary challenges. That why we are not able to develop further in this sphere of rare diseases, even though when in the past decade we have made a lot of medical advancements. So apart from this, Harshit, what do you think are probably more specific challenges? I know one is the financial restraints and constraints that we have talked about because it's extremely expensive. It does not affect a large number of people. There is no enough support that has come forward to probably devise treatments and therapies. And now on one end, we have this problem of lack of data in India. And what do you think are other challenges which are stopping the growth of progress in this sphere?
So I think, yeah, so the prevalence, the number of people who are affected by rare diseases is the number one challenge. And because of that, you don't, as you said, we don't have companies, and even little companies don't have an incentive because the chances of them getting a good drug and then making a profit is quite low. And they have to charge a lot if they want to recover their cost and make a profit. You don't even have researchers and scientists and institutions looking at rare diseases because they are rare. And if you discover something new in maybe diabetes, you get into a very prestigious journal, you get fame and you get funding. You can secure funding for diabetes, you can secure funding for hypertension. Try securing funding for some rare disease, and it is like pretty difficult. So the incentives for researchers, even academic researchers who are at government institutions,
Harshit,
are
I would want to stop you on that point. Like few minutes ago before the break, we were talking about who should be held responsible, and we had this disagreement about private corporations and government. Don't you think the government can step in and probably secure grants? You spoke about how it's much easier to secure funding or grants for probably when they found something new in hypertension, diabetes. Don't you think government can play an important role here? Okay, if not about funding, but helping in research and helping in garner data.
so you have 100 rupees. What do you think would be a good way to spend that 100 rupees? Spending that somewhere on maternal and child nutrition healthcare, or spending that, let's say, some liposomal storage disease or cystic fibrosis or some disease like that, which affect a small population.
I completely agree with you. Maternal and infant health in India are extremely poor, and if we even focus on SDGs, we need to focus on that. But I'm also saying if we follow that approach, then no one will ever probably want to fund for it because you spoke about how private corporations are probably seeking more for profits. They're looking for profits, and if even if states stop providing grants of funds,
So,
who can
Meg,
probably be
I
the
was talking
yeah.
about private corporations and researchers also. Researchers, scientists, healthcare professionals who are working even in a government setup. You want to publish, if you want promotions, you want fame, you want to publish, you want grants, you want to publish on a, a disease which has focus. You don't want to like write about, or even if you want to, you cannot secure funding. I think instead of like putting money in research, that money would be better be put into somewhere in counseling, and as I said, in counseling, in preventing these diseases. And it would be better if you would allow people who are doing research on rare diseases to get tax breaks. Maybe, for instance, if I order a machine which costs me like 10 crores, not put GST on that and not put custom duty on that. So that would be helpful if I'm able to do that. And like a lot of drugs which have not been tested as extensively because the population, the sample size is much lower. That same way that FDA approves drugs in US, like allow them to be passed here. So it would be much easier for companies. The cost of developing a new drug would decrease. Yeah, and maybe fund into research which helps you repurpose existing drugs into therapies for rare diseases. This is also a line of research, and nowadays, even artificial intelligence is used to repurpose. Even in COVID, a lot of people were trying to develop therapies from scratch. But if you want to use existing drugs, if you want to use existing manufacturing capacity, and if you want to use existing approvals, and if you want to use a safe drug, it is, and you are in a resource constrained environment, it is all a wise decision to repurpose pre-existing drugs. So I don't think the government can fund research into this. At least the Indian government cannot. We have a lot of areas in which you put money that would get you better results. But yeah, that's it.
So are you trying to say like maybe we can divert a focus on maybe preventing rare diseases, and then how you spoke about probably giving training or communication tactics to health workers on ground to make people even
So
more aware?
yeah, so that is what I'm not trying to say that. I'm saying that should be the government's primary focus. If we say that we don't have enough funds to treat people with genetic disease, with the best we can do is put that money in prevention, and that would be super helpful. Yeah, training, prevention, counseling, and even though I'm not expecting every ASA worker or Anganwadi worker to look out for genetic diseases and stuff like that, but what I ideally expect is at least they should be able to redirect the couple, like the high risk couples, the couples which had babies with similar diseases previously, or someone in their family had, or who are of advanced age, or who are in tribes, or who live in society where consanguineous marriage, or who marry within like a small group, to be referred to a person trained in this. That would be a much better use of money instead of putting that money into research of rare diseases. That ideally, we should put money into research, but looking at how stingy the government is with money when it comes to the health sector, the money is better used here.
Yeah, I think you what you were saying is making sense, that probably putting in money and at the moment can might not be the most feasible idea. But like we are talking about rare diseases when probably it doesn't affect us or people around us. But for someone, we are talking about rare diseases on Rare Disease Day because it's approaching us. There are 300 million people around the globe who are living with rare diseases every day. And even if symptoms don't appear very very early in their lives, they're probably living it the most parts of their most years they're living with it. So an economic financial burden, with that kind of burden, it becomes extremely impossible for them to get their own treatments. So what I think is that governments around the globe should start working on incentive based care. They should also focus on preventive care so that we can save as many people as possible. What do you think about it?
It is like quite impossible if you are suffering from a rare disease to get treatment, at least in India. Yeah, we want the government to sort of let go of regulatory hurdles and let people develop new drugs and give them maybe some sort of monetary incentives or some incentives to give people and companies some sort of incentives to create and repurpose new drugs. And the most important part is prevention. So if you are able to prevent rare diseases, that would be the ideal scenario in a country such as ours. That is what I think would look like a good policy. And so the government has created 8 centers of excellence. These are the normal aims and Institute of Eminence. They have named as centers of eminence. These are the normal tertiary care hospitals or institutes which are named every time. So I do agree that tertiary care, we need specialized tertiary care, but more focus should be on preventing them. And that has to start at the primary level, at the level of PHCs, at the level of Anganwadis.
Yeah, I think you're correct with saying that it will not make sense having these 8 centers of excellence. I think centers of excellence across the globe if we do not stop these rare diseases at the level when we can actually prevent them at the first stage.
Yeah, if we employ these preventive strategies successfully, we would be able to make rare diseases even more rare so that a lot of population don't suffer from these. And I think at a point when we are able to decrease their prevalence, then we'll be in a much better position to fund, to put money into the treatment of the people who are left. Even though non-diseases such as these will, maybe they'll increase. Even though if we are able to reduce prevalence of the existing disease, new diseases and new type of disorders may be found as medicine progresses and as science progresses. But it would be the best thing if we are able to make rare diseases even more rare.
Yeah, I think that would be our best shot, right? To probably reduce the prevalence of these diseases. And you correctly said that there is always a possibility for new rare diseases coming up. There is always a possibility like that. But right now, what the best we can do is probably work at the most basic level and prevent them from happening and reduce the prevalence. And then probably we'll be in a better position to take care of people or to probably fund research more. And with that, I think we would like to end this episode of All Things Policy. Listeners, please keep tuning in for our new episodes. We'll be back with another episode tomorrow. Thanks, everyone.
Okay, thank you. Bye-bye.
Thanks, Harshit. Bye.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
Are you looking for finance products and services that can enhance your personal finance experience? Are you looking for a space to talk about your financial product or service? And are you looking for a crisp talk show where the conversation is all about money? Well, your search ends here. Hi, my name is Anupam Gupta and I'm host of the Paisa Paisa podcast, and I invite you for the conversation about your personal finance on each Monday on the IVM Podcast app or the website or on any podcast streaming platforms. See you folks.
Working Monday to Friday glued to your chair making you feel dull? Worry not. Get your 5-minute weekly dose of travel around the world with postcards from nowhere. Join me every Thursday as I explore the strange, obscure, and fascinating parts of the world and bring out facets of travel you may not have thought of before. You can find us on the IVM Podcast app, website, or wherever you get your podcast from.